Hello everyone, my name is Lon Armstrong, and for my presentation I'm going to be discussing leptospirosis. So leptospirosis is a bacterial disease that is caused by Leptospira, and it's a gram-negative spirochete that's typically found in tropical, warm environments, and in particular you will come across this bacteria in moist soil, puddles, rivers, streams, and even floodwaters. Leptospirosis is a zoonotic disease, which means that it can be transmitted from animals to humans, and while there are many reservoirs or hosts that are responsible for disease transmission, the most common ones are cows, swine, dogs, mongoose, and even rats. Now, unfortunately, leptospirosis is a global burden, as is illustrated by this map here, and I've strategically placed these little leptospira squigglies to pretty much indicate the countries that are dealing with leptospirosis. As far as numbers are concerned, in humans there are about 1 million cases reported a year, and of those cases, about 60,000 people will succumb to the disease. Now, the reason for the wide range in case fatality rate of 5 to 70%, it really depends on a country's economic capacity as far as being able to provide health care, if it even has diagnostic tools available, etc. And it also depends on a person's ability to seek health care, access it, and even afford it. Other things that contribute to global burden are poor vector control. If I use the rat as an example here, they are everywhere. They proliferate quite rapidly, and it is very difficult to keep their numbers under control. Rapid urbanization, as far as people traveling more and bringing the diseases with them. Climate change, remember that leptospirosis thrives in warm regions, so the earth is warming up rapidly, and with that we will be seeing more cases of this disease. As far as transmission is concerned, it's kind of a vicious cycle in that, again, using the rat as an example, it will have acquired the bacteria from the environment and later excrete it back into the environment through its urine. And using this body of water here as an example, if this person with broken skin enters the water, or somehow even gets the water into his eyes, because Leptospira easily enters the body through broken skin and mucosal membranes, this is a surefire way of contracting the bacteria, which then will manifest into the disease. As far as symptoms are concerned, I'm going to use my made-up misdiagnosis alert here for the fact that in the early stages of the disease, leptospirosis can present as the flu. And in the more advanced stages of the disease, leptospirosis shares similar symptoms to that of dengue hemorrhagic fever. And this can be very problematic, especially for physicians, as they go through the process of differential diagnosis, which can later on affect statistics, right, surveillance, because these cases might be going unreported. If a doctor is unable to accurately diagnose leptospirosis, then the number that I gave earlier, about 1 million cases occurring annually, that could be an underestimate of what is really happening right now. Some affected body systems in the humans are the brain will receive cases of meningitis, the liver will have jaundice, for the lungs, pulmonary hemorrhagic syndrome, and the kidneys will see kidney failure. Now, while kidney failure, jaundice, and meningitis are, they can be pretty much attributed to many diseases, right? Pulmonary hemorrhagic syndrome is actually considered an indicative feature of leptospirosis in humans. Unfortunately, by then, that's considered the advanced stage of the disease, which makes treatment a bit more complicated. So for those who are at risk, we're talking about people who enjoy water sports, or even people who use certain water sources for agriculture needs, or bathing, washing, and even drinking. Again, the routes of transmission are mucosal membranes and skin, broken skin, because this bacteria is quite opportunistic. Farmers who are in constant contact with livestock, again, remember cows, and of course veterinarians who are always dealing with dogs and their urine, and then people who are farming and are constantly being exposed to moist soil. So as far as prevention and treatment are concerned, if we can somehow effectively and even permanently reduce the rodent population, that would significantly help, along with wearing gloves to keep our hands protected from the moist soil or even urine, etc., especially if we have broken skin. Washing your hands, keeping them clean, that is vital. Keeping our surroundings clean, thereby reducing the rodent population. as well as practicing vaccination protocol, especially for those canines, as there are vaccines available for them, but right now there are no vaccines for humans against leptospirosis. If you do contract the disease, an early intervention with the use of a broad-spectrum antibiotic such as doxycycline will will definitely do the trick. Thank you so much for watching. This concludes my presentation.